Welcome to Aula DENTAID Stay at Home, and thanks to all of you who are connected worldwide. We are very excited as we have Dr. Andrés Pascual teaching today's course. Dr. Pascual is Doctor Cum Laude in Dentistry by the International University of Catalonia, Master in Periodontology, lecturer at the Department of Periodontology at the International University of Catalonia, member of the boards of directors and representative of research and dissemination of the Spanish Society of Periodontology and Implantology, and we could continue across his extensive curriculum. In his conference, Dr. Pascual will address the current and fundamental issues regarding how, from our field of action, we can help to stop this pandemic, the oral hygiene measures for the prevention of COVID-19. Dr. Pascual?
Ernesto, thank you very much for your presentation. Thank you, everybody, for being connected today and enjoying what my lecture might probably help you with. Thank you, DENTAID, for this opportunity, and hopefully we will be out of our homes soon and be able to continue with this education in person. I will proceed to my presentation. Here we go. So, as Ernesto mentioned before, today we're going to talk a little bit about oral hygiene measures that we can use to prevent the COVID-19. And let me start by mentioning some curious facts. And for now, we know that the whole body, the human body, it's built from around 37 trillion corporeal cells. But we also know that for each of those cells, there might probably be around 1.3 bacteria, what makes around 48 trillion bacteria of our body. That doesn't mean that we are more bacteria than cells, because in the body weight mass, the cells are much more heavier than the bacteria. But having so many bacteria in our body, that means that those bacteria are probably very, very well involved and related to the functioning of our body. But it's also important to know that among those cells and bacteria, there's going to be also a very high number of viruses, around 60 billion viruses living in our bodies, and also some fungi and millions of mites that inhabit in the body. This is quite important because recently, and something that it's very popular right now, it's talking about the microbiota of our bodies. Because microbiota seems to interfere or make the working, the systemic working of our body in a way or another. But we should make a differentiation between two important terms. Normally, some people talk about microbiota, and microbiota it's nothing but the set of microorganisms that resides in our body. But what's really, really important, it's the term microbiome. Why it's microbiome even more important than microbiota itself? And it's because the microbiome is a broader term because it refers to the entire habitat that includes these microbial communities that we mentioned before, the genes that are related to these bacteria, but also the metabolites that are interfering in the systemic working of our body, as well as the environmental conditions that surround all these bacteria in each of their locations. For now, there are 4 or 5 microbiotes that are very well recognized and being studied in the human body. The oral cavity and the respiratory tract microbiota, these are 2 independent microbiotas, the skin microbiota, the gut microbiota, and the urinary and vaginal microbiota. Which is the most important? Obviously, for what we know until now, is the gut microbiota, as some people like to refer our second brain. And it's because this microbiota that lives in the gut makes possible a lot of the process that happens in our body and makes it happen in one way or another. But if you want to know as a fact, the second most complicated microbiota in the body is the oral microbiota, even bigger and more complex than the vaginal or urinary microbiota. Only in our mouth, there is more than 1,000 different species. The chart that you see on the left, this circle, each of those slices refers to one bacteria in particular. And it's very important to understand that depending on the number and the presence of some of these bacteria, we will be associating this microbiota with a health situation or a disease situation. But it's also very important to understand that inside the mouth, there are different places for living for these bacteria, like the subgingival plaque, the supragingival plaque, or maybe depending on the tissues, if it's the keratinized gingiva, or if we are in the throat tissues, there might be different type or different families of bacteria. And another fact that it's quite important is the individual variability of this microbiota. Not all of us and not all the regions of the world have exactly the same kind of microbiota. This microbiota can be different between individuals, but what is most important about this fact is that even if we share the bacteria, those bacteria will not live exactly in the same way in one body or the other one. Let's take, for example, a kiss. An intimate kiss of around 10 seconds can transmit between one individual and the other one around 80 million bacteria. But will these 80 million bacteria stay and continue living in the new environment? No, because that will be completely directed to the susceptibility of the individuals. And that also happens not only with the bacteria, but also with the virus and the fungi. And that's why I would like to introduce two important terms. First of all, it's symbiosis. When we talk about symbiosis, is when we have a good relationship with the amount and number of bacteria in the oral cavity. And if we have this symbiosis, we will maintain an oral health environment. But what happens when the balance of these bacteria is altered and the bad guys or the conditions for the bad guys let them grow and multiply in our mouth? Well, we're going to enter into a state of dysbiosis, and dysbiosis will lead to disease. And between this disease, we have the most common disease of the oral cavity are caries and periodontal disease. But also considering nowadays that a lot of individuals have dental implants in their mouth, we have to understand that dental implants are part of the oral environment, and for sure there will be periodontal peri-implant disease related to these implants between like mucositis and peri-implantitis. And of course, also the presence of bacteria in our mouth and some of the infections that we're talking about will lead to halitosis, which is a very common and popular circumstance among people. And some people believe that some countries have better or worse oral hygiene, and that it's true. Here you can see this is an index from oral status, and you can see different countries. It depends on where you're from. You can see different values in here. The lowest rate, it's 32. The highest rate, it's 60. And the lowest is the better. The highest is the worst. And for example, if you go to Europe, where I live right now, you can see that the numbers are very close to 60, because probably Italy and Germany have the best scores. But when it comes to Spain, France, and the United Kingdom, it seems that we have some issues to deal with oral hygiene. If you move to Western Europe, you will see numbers that are also quite high. If you go to the United States, for example, the numbers are a little bit lower. We're on around 38, which means that oral hygiene is not so popular around the whole world, and it's something that we should bother and take care of it. And so the World Health Organization, in an assembly that took place in 2007, considered that it was very important to take care of oral health, because oral health was an important component of general health and quality of life. And so it's a lot of research related to this in the past few years that is showing us that the best oral hygiene, the best quality of life that people have. But an important fact is that the worst oral hygiene that we have, the worse our body will work, and that will have a direct impact in our daily living. So that's why it's so important to focus in prevention and treating the disease, and promoting oral health between the inhabitants of each of the countries. And another important issue is the fact that the mouth is not an isolated organ. The mouth is an organ that belongs to the body, and we have to remember to put it back to where it belongs. That means the body. Tooth and soft tissues, periodontal health, and the oral health in general will have a direct impact in systemic health of the individuals, and that has been shown and proved through the latest decades, showing us how it's completely related. The systemic relation will lead to different complications in a direct way between the oral health and some disease, like, for example, the most common one, the diabetes. But what about the virus? What do we know about the virus and the oral cavity? Well, as I mentioned before, we have a lot of viruses in our body, but it's also important to understand that viral infections can affect the oral cavity, and these viruses will have also an influence on the way the oral disease will behave. So we understand now that viruses are also important and are part of the environment of the oral cavity. But what about the disease of the COVID-19 and the oral health? Well, this is a fact that we still don't know much. I was in a conversation with Dr. Mariano Sanz earlier today, and he was mentioning us that some universities are already starting to work on the impact of COVID-19 and the relationship with oral health, and how oral disease can interfere in the disease of COVID-19. So for sure, in the next years, we will learn a lot about this disease. But for now, there are some facts that we have to understand and that we have to deal with it during this pandemic condition, and in order to avoid more complications. First of all, for those of you who still don't know, the way that this virus works, it's via zoonosis. That means that these are viruses that are originally from an animal, a different species than the human, and they have to go through another animal in order to contagiate human. In this case, the origin of the SARS-CoV-2 is probably the bat. The etiologic agent is the SARS-CoV-2. That's the name of the virus, and it has a genetic homology with previous two viruses like the MERS-CoV and the SARS-CoV. The first time that the SARS-CoV-2 was isolated was in January 7, 2020. This was a very important news for the world, but it seems that it was not enough because we're still not capable of controlling or dealing with this virus, not even in the research that they're doing in the labs. And for what we know now, it's a positive single strain RNA virus, and it's very capable, as we have seen, of infecting vertebrates. How it works and how it deals with the body is that this virus attach to a cellular receptor that is called the angiotensin converting enzyme 2, the ACE2. And comparing to previous coronavirus, like the influenza or the other SARS, we know that this one is like the affinity for the receptors is up to 20 times higher than the other one. And also, for what we know until now, it has been suffering different mutations during the pandemic around the world. As I mentioned before, this coronavirus need the ACE2 receptors, and what it's important, it's that one of the places with the highest number of ACE2 receptors is the oral cavity, in particularly the tongue, and also the upper respiratory tract. And that's why we're seeing that all the tests that are being performed are normal. The samples are normally taken from the back of the tongue and the respiratory tract. And it's very important also to understand that this is an area where the virus multiplies with a higher rate than in other parts of the body. So that's what makes it so easy to contagious. And it's also important to understand that it's a potential way of transmission. It's the saliva and the mucus that comes from our nose. The disease caused by the SARS-CoV-2 is the COVID-19. That's a disease that we suffer. And for what we know right now, the oral cavity is a very potential high-risk site for infection of the SARS-CoV-2. More facts about this virus is that, as we already know, the high rate of transmission is very high. For each individual, it's considered that probably for one infected, it's capable of infecting 3 people directly. The incubation period can take from 5 to 6 days up to 14 days. But the most common signs appear between 5 to 6 days. I'm going to make a small parenthesis here because I would like to tell you that I had this disease at the beginning of March, and actually I was capable of discovering where and when I was infected due to this 5 to 6 days. It was very, very easy to make the calculus and knowing it. The disease duration is about 2 weeks, but there are some more severe cases that can last longer. And now for the data that we have, the majority of the patients, it lasts no longer than 6 weeks. But there might be some isolated cases that and where the disease can last longer. And even if all the signs of the disease disappear, you can still be a transmitter of the disease for at least 15 days after the illness. And another important fact that we need to understand and known is that this virus stays and it's capable of surviving on different surfaces like steel or plastic. And depending on the surface, it can last from 4 hours up to 72 hours. Okay, but when we talk about steel and plastic, we're talking about between 12 to even 36 hours of surviving of the virus. The transmission mechanism, as it's already well known by the population of the world, it's by droplets of saliva, the micro droplets, the flush droplets as they're called, human fluids, aerosols, and direct contact with the contaminated surfaces. And that's why in some places it's being recommended. They're recommending the population to wear gloves. But remember that if you're wearing a glove, you have to be careful of not touching yourself with the gloves that previously touch a contaminated surface, because you will get contaminated anyway. Up to yesterday, the number of cases in the world was over 3 million people. The number of deaths was over 200,000 people. The number of recoveries was around 900,000 people. And the number of active cases is it's almost 2 million people right now. But as you have seen, this is a disease that it's growing every day more and more. And even if in some countries the curve of contamination is going down, in some other countries it's going up. So we still need a few more weeks before we start seeing this curve going down everywhere in the world. So it is very important to understand that if we have symptoms or if we're suffering from COVID-19, there are some oral hygiene preventive measures that we have to take in our homes in order to be better and preserve our oral health. As it's well known, we need to wash our hands several times a day. This is very important, especially if we're living with other people in the house. If we have to cough, we don't have to cover our mouth with our hands because, as I mentioned before, the saliva, it's full of virus. So whatever we touch with our hands after coughing will be covered with this virus, and it's going to be easy to transmit. So that's why it's recommended to use the inner part of our elbows to protect when coughing or sneezing. Have a lot of Kleenex or soft tissues to clean our nose, and be sure that we don't leave any of these paper tissues around the house or around any places. We have to throw it in a container with a plastic bag. If we're feeling symptoms, it's important to get in contact with medical services in order to receive information. And we have also to remember that we should not forget to keep our oral hygiene measures, because as I mentioned before, we must try to reduce the amount of viruses in our mouth, because this disease is completely related with the viral charge. For the oral hygiene instructions, first of all, as I mentioned, you have to wash your hands. Remember that a good hands cleaning will take around 40 seconds. And every time we're going to perform oral hygiene, we have to wash our hands before and we have to wash our hands after. It is recommended, as usual, to brush at least 2 or 3 times a day. But remember that if we are confined to our homes, everybody is spending more time eating more food or more times. So it might be necessary that instead of 2 or 3, there might be necessary to brush our teeth at least 4 or 5 times a day. Remember that we have to do interproximal hygiene at least once a day. It is recommended also to have a well-balanced diet. Considering the fact that we're home, we should avoid sticky food. The intakes of sugary snacks and sodas it should be very limited, because not everybody is aware of brushing their teeth as many times as necessary. So this might lead to further consequences like a higher number of caries. And remember to drink a lot of water during this period and avoid smoking as possible. For when it comes to brushing, we should continue with our brushing technique, and we can use an electric or a power toothbrush or a manual toothbrush. But remember always to rinse and shake the brush to remove the excess of water that we leave after using it. If possible, we want to use a cap with ventilation to protect the head of the toothbrush. We should store it in an upright position in order for the dripping of the residual water to go down. Please remember that if you're in a house with other people during this whole process, we should avoid toothbrushes having contact with other people living with us right now. And if you pass the disease, or if you have to recommend this to your patients, please remember to replace the brush after the infectious process. When you start feeling well, throw your toothbrush away and replace it with a new one. If you are positive, or if you are giving recommendations to a positive person, remember that it's quite a good recommendation that after finishing brushing your teeth, immersing the head of the toothbrush in a glass with a 0.05 sodium hypochlorite solution for at least 30 minutes. After this time, we have to rinse properly the brush and let it dry for the next time we use it. This is important because the SARS-CoV-2 virus is very sensible to the hypochlorite, so it will kill whatever it's in the toothbrush. And also, it's very important not to share the toothbrush during this period. Well, never, not even when we are under regular circumstances and not confining. Remember to close the toilet lid before flushing, because there's been some evidence of fecal transmission of this virus. And as I mentioned before, with the very small droplets of water, if there is virus, it can, and we normally keep our toothbrushes close to the toilet because the bathroom is a small room normally. So there might be a possibility, and there are some articles making mention to this fact. And remember to keep the bathroom clean. That's very important during this whole disease. Another important thing we can use during this process are the chemical agents. Among the chemical agents, there are 4 chemical agents that have been recognized by the WHO, the World Health Organization, and it's povidone iodine, hydrogen peroxide at 1%, cetylpyridinium chloride, or essential oils and alcohol. For For the first two, the povidone iodine and the hydrogen peroxide, these are recommended to rinse before a dental treatment. But these are not the kind of mouthwashes people will use as an in-home mouthwash recommendation. So we regularly, we prefer to use cetylpyridinium chloride or essential oils. The fact is that the ones that have evidence is the cetylpyridinium and not the essential oils. When it comes to cetylpyridinium chloride, better known as CPC, this is a maximum safe level mouthwash. We can use it every day with no problems. It's an anti-plaque agent. It has a substantivity that can last for up to 5 hours, and it has a broad spectrum of actions in different types of bacteria, fungi, and some viruses. And it is important to know that CPC have a few articles or some research showing that it has a virucidal prevention against coronavirus type viruses. Like, for example, the research by Popkin, in this case, they compare the use of CPC and how affects the influenza viruses. Remember that influenza virus is also a coronavirus by the type of virus that it is. And in this case, CPC demonstrated that it's capable of destroying and causing a rupture in the lipid membrane of this type of viruses, demonstrating a mortality of up to 86%. Showing that it's effective in the inactivation of a lipid envelope virus like the COVID-2. Another article by Mukherjee, and in this case, they use a spray with CPC over 94 healthy volunteers. They use this spray in the upper airways, and after a period of evaluation, they found that the test group, applying 3 times a day for 75 days, a 0.10% solution of CPC, demonstrated that there was a lower incidence of viral infections like influenza, coronavirus, or respiratory syncytial virus, and when these infections occur, it was less severe and the period of duration was shorter. So as a preventive way, we can use the CPC in order to avoid viral charge in our mouth. And due to this evidence, some organisms are recommending the use of CPC during this pandemic COVID-19. The Dental Council of Spain use it as one of the recommendations. There is an article recently published with a protocol that they use in the School of Dentistry of the Wuhan University, how they deal with the emergency treatments during the period of the pandemic, and they recommended the use of a CPC mouthwash before each of the treatments. And also in Italy, before all this coronavirus problem, in I think it was the year 2013 or 2017, I'm not quite sure, sorry for that, they start recommending the use of CPC as a previous mouthwash for dental treatments. As I mentioned before, the tongue, it's a full of ACE2 receptors, which are the favorites for the coronavirus. So it's important also to keep the tongue clean. And for that, it is recommended a daily use of a tongue scraper to remove the tongue coating and eliminating the epithelial cells and the microorganisms that can be attached to it. So as a summary of this, remember that it's important to brush at least 2 to 3 times a day. We must recommend at least 1 time a day interproximal hygiene with interproximal brushes, flossing, or even combined with an irrigator. Cleaning our tongue once a day, and using a mouthwash 2 times a day, in this case, cetylpyridinium chloride, 15 millimeters for 30 seconds might be helpful. So, for the conclusions and to make this short and not making people getting bored with this, remember that the oral cavity has a very high potential risk for infection of SARS-CoV-2 due to the density of the ACE2 receptors, especially in the tongue. And that's why it's important to use a tongue cleaner as part of our oral hygiene routine. Remember that during the first 10 days of the infection with the virus, there's going to be an upper respiratory tract infection. So the mouth, the nose, and the throat will be full of viruses. And maybe the use of a CPC mouthwash can help in a preventive way because of the virucidal effect on the mouth. And we also have to remember that there is a direct relationship with the viral load and the severity of the disease. So if we keep our mouth free of virus or the higher or the lowest load of virus, there might probably be not so strong disease. And remember that there might be some evidence showing that the use of CPC mouthwashes and toothpaste might help to prevent the COVID-19 and reduce the spread of the disease. Remember to wash your hands and brush and rinse. That will help us to control a little bit better the COVID-19 disease. And I would like to thank again the people from DENTAID for this opportunity to letting me give you this advice. And now I will give a few minutes to the representative of from DENTAID. Ernesto has some words for you.
Dr. Pascual, thank you very much for this fantastic conference and for explaining the main measures that we can apply from our field of action in order to help to stop the pandemic of COVID-19. You mentioned the efficacy of CPC against SARS-CoV-2 virus and some viruses with a similar structure to this one. I would like to remind to our audience the main DENTAID solutions containing CPC. So, as you know, DENTAID is a company focused on oral health solutions to improve the oral health of people worldwide. We have manual and sonic toothbrushes. We have interproximal devices. Remember, Dr. Pascual told us that in our tongue, we have ACE2 receptors where the SARS-CoV-2 binds. So we need to use daily a tongue scraper. It's very important to use these elements of oral hygiene to prevent the COVID-19 disease. And with CPC, we have a wide range of mouthwashes and toothpastes. We have Vitis gingival, intended for the prevention in gum diseases, and it contains 0.05% CPC. We have Vitis orthodontic with the same concentration of CPC and intended for a daily care use product for orthodontic patients. Both of them can be used daily. We have the Periite brand formed by two sub-brands. Periite intensive care with a combination of 0.12% chlorhexidine and 0.05% CPC as an adjuvant of the periodontal treatment. Okay, thanks to this combination of both antiseptics, we have a synergistic action. We have another product in this brand, Periite Active Control, which contains a lower concentration of chlorhexidine, 0.05% plus 0.05 CPC. Thanks to this lower concentration of chlorhexidine, we can use it in a longer term period of use. is intended for the periodontal maintenance, but for us, it's also recommended for risk patients. And in this pandemic situation, it is our first choice product because of this combination of CPC, which has demonstrated activity and efficacy against viruses with similar structure, and because of the chlorhexidine. We also have the Alita brand with the same combination of chlorhexidine and CPC and other active ingredients against, for the prevention and treatment of bad breath. And now, if you have any questions, I think we have run of time, but let's see if there are any questions. Okay, first question is for you. Is this normal virus, and can temperature affect or reduce the virus?
Well, I believe it's a normal virus because I don't know what is not a normal virus. This is a very harmful virus due to the disease that causes. But this is a lipid layer cover virus, so it's very similar to the influenza virus and to previous coronavirus and like many other viruses. So as a structure right now, the problem is that it's not so easy to deal with it, no? But it's not so as a virus. The structure of the virus is not so complicated. It's similar to other viruses. Temperature can affect it. Yes, of course, temperature can affect it. Over 60 degrees of temperature, that will cause the death of the virus. So any kind of sterilization with heat that goes over 60 degrees will help the damage of the virus. And so it's also the recommendation, for example, that if you're washing your clothes or at the hospital clothes or working clothes, they recommend to use 60 degrees of water. But the thing is that inside your body, even if you drink a tea that it's over 60 degrees, the only thing that you will cause is burn yourself, because that will not kill the virus in your mouth. So be very careful with that.
So thank you very much, Dr. Pascual. I'm afraid we have run out of time. I hope we can see you in next Aula DENTAID courses. Thanks to all of our audience, and overall, stay safe.
Thank you, Ernesto. Thank you, everybody. Please stay home as much as possible. Be safe, take good care of your families. And as I mentioned at the beginning, I hope we get to see you all in the future in person. Bye-bye.
Thank you very much. Bye-bye.